Bladder diversions. There are 3 of them. When you go through a radical cystectomy and have your bladder removed, you'll have a choice of 3 diversions. The first is the ileal conduit. That is the outside bag. It is also the most common. Most people who have their bladder removed get the ileal conduit. The other 2 are what are called continent diversions, which means they hold your urine within your body. So there are 2. They are both made out of various parts of your intestine, depending on which one you choose. So there's the neobladder. The neo is clearly the most back to normal. They build a bag to hold your urine and hook you back up. There's lots of things that go with that, but I am not an expert in that. The third is the Indiana pouch. Again, they build a bladder or an inside bag out of your intestines. But with the Indiana pouch, they also built a channel out to a stoma, which is an opening in your abdomen, and you empty your bladder with a catheter through that stoma. So those are the 3 diversions. Here's why I chose the Indiana pouch. I was not a candidate for the neobladder for a few reasons. So looking at my other 2 choices, I am a woman who's been pretty heavy my entire life, and I already had body image issues. I did not want a bag holding urine outside my body. I just didn't want to. But my surgeon also said to me, yes, the Indiana pouch is a bigger surgery and it's longer recovery, but you're very healthy and you can handle it. And he said, longer recovery, we're still talking less than a year. You're 63 years old. You have at least another 20 years. I'm recommending the Indiana pouch for the everyday quality of life after you get through the surgery. I'm really glad he put it that way because it helped me when the surgery and the recovery were tough to know I can get through this. So with the Indiana pouch, I have this internal new bladder or bag built out of my intestines. It comes out to a stoma in my stomach. I take a catheter and I put it into the stoma. The stoma has no nerve endings. You can't feel it. The catheter is long. And I empty that either into the toilet or a container every 4 hours during the day. And then I sleep through the night and empty in the morning. I empty right before I go to bed and then first thing when I get up. So that's basics with my Indiana pouch. But those are the 3 diversions. And you really need to talk to your surgeon, understand what they're recommending. But I would say for the Indiana pouch, if you're interested, you want a surgeon who does a lot of them and has good outcomes. Ask your surgeon, how many do you do and what are your patient outcomes? For me, this was absolutely the right decision.